Have you ever finished urinating or peeing and thought, wow, that burned like fire? Or you have had urinary tract infections, or you have had so many UTIs or urinary tract infections that you actually forgot what it feels like to pee normally again. If this sounds like you, then keep watching, because today we're going to be discussing all about urinary tract infections, why they happen, and why it's not actually your fault. Hey everybody, I'm Dr. Nabila Noor, Urogynecologist and a pelvic reconstructive surgeon, and welcome back to my YouTube channel. If you're new to the channel and like what you see, don't forget to hit the subscribe button, and also do share the episode with a friend. I promise you, so many women will thank you. So let's start by understanding the biology a little bit. So the bladder is an organ that holds urine, and it's connected to a pipe called the urethra, which is the pipe through which urine comes out. Now, here's an interesting part. Did you know that a female anatomy was designed uniquely to make you more prone to developing infections, more so than men? Sounds curious, right? Why is that? Well, the urethra, the pipe through which urine comes out, it's much shorter in females than men. In women, it's really about 3 to 4 centimeters. Because of the short length of the urethra, there's less space for the bacteria to climb up to get into your bladder and cause infections. Number 2, the urethra is actually very close to the vaginal opening as well as the anal opening, which is where stool comes out from. So as you can imagine, there's a higher and easier chance of contamination from stool and the bacteria from your stool tracking up your urethra and then into the bladder, causing infection. So often I have patients who come to my office and they're embarrassed, they're frustrated because they think they're doing something wrong, or it's a hygiene issue, maybe something about their lifestyle that's making them more prone to infections. The truth is, it's not your lifestyle, it's not you. It's just plain and simple biology. A few weeks ago, I had a patient in my office who was so frustrated because she was getting her 5th infection in a matter of 2 months. Yet joking with me that, Dr. Noor, I should have a loyalty card with my pharmacy where every 5th antibiotic should be free. She wasn't joking. This is what we called recurrent urinary tract infections, where women have 2 or more infections in a matter of 6 months, or 3 or more infections in a matter of a year. As frustrating as it can be, it's really important to understand what are some triggers that's making you more susceptible to developing these infections. So let's discuss the 5 topmost UTI triggers. Number 1 is changes in the vaginal microbiome. Our vagina has good bacteria that actually helps protect our body from developing infections. If for some reason this vaginal microbiome gets disrupted, then women are more susceptible to developing infections. Things like antibiotics, soaps, douching, chemical wipes, hormonal changes, all these things can have an effect on your vaginal microbiome, thus changing them and making you more susceptible to infections. Number 2, or intimacy. Not because is dirty, not because you're doing something wrong, but having intimacy or intercourse or vaginal penetration physically moves the bacteria closer to the urethra, which is why a lot of women may notice they get an infection after they have been intimate. Number 3, dehydration. If you're not hydrating yourself adequately, you're not going to be urinating enough, and what happens is the bacteria that's already in your bladder is not going to be flushed away and clear out. So they get concentrated into the bladder, making the infection worse. Number 4, constipation. If your colon is full of stool, it pushes the urethra and the bladder and closes it, making it difficult for the bacteria in your bladder to come out and be flushed away. And finally, number 5, menopause or low vaginal estrogen. As women go through menopause, there's a decrease in their estrogen level, which makes them more susceptible to developing infections because the low estrogen changes that vaginal microbiome we were talking about earlier, making women more susceptible to infections. Now, along with menopause, younger women who may be on birth control pill or breastfeeding also have low estrogen level in their vaginal tissue, which again can affect their vaginal microbiome, making them more susceptible to developing infections. Myth versus fact. Can having cranberry juice prevent infections? So here's the thing. Cranberry supplements have been studied, especially supplements containing at least 36 milligrams of a chemical called PAC, proanthocyanidine. Oftentimes, I do recommend using cranberry supplements for my patients who are suffering with recurrent urinary tract infections. But remember, it's not cranberry juice. Why is that? Because cranberry juice can contain a lot of sugar, and that's not healthy for you. Cranberry juice just does not have enough of the active ingredients that's needed to clear out the bacteria. It contains a lot of sugar, as I mentioned. So is cranberry juice good for you? Sure it is, but not for the purposes of reducing infection like the way you're expecting it. So when should you worry if you're getting infections? So every woman will probably get an infection here and there in their lifetime. But if you're truly getting recurrent urinary tract infections, like I explained before, which is 2 or more infections in a matter of 6 months or 3 or more infections in a matter of a year, and these are culture-proven UTIs, meaning you tested your urine and the urine came back positive, showing that there's bacteria growing in there, then that's the time to seek the consultation of a specialist like a urogynecologist like myself, who can help you understand your triggers, help come up with a preventative plan so that you don't develop these infections again and again. Oftentimes, many women get focused on just treating the symptoms, but it's equally important to understand, why is it that you're so susceptible to developing infections? What are your triggers? Do you have any kind of anatomical abnormalities? Do we need to do any kind of invasive testing? All these things are really important to understand your body and help give you the most information that can help prevent these infections for you. So there you go, everyone. Please don't blame yourself if you continue to have infections, and if you are truly getting recurrent urinary tract infections, then make sure to seek the help of a specialist. Hope you found this video helpful, and if you did, again, don't forget to hit the subscribe button and also do share it with other women in your life. I really hope with this video that you can have a better understanding of why infections happen, what may be your specific triggers, so that we can get you the help that you need. Keep watching. Until then, stay well, stay healthy, and don't forget to take care of your pelvic health. Bye!